Good evening, everybody. My name is Stefan Griego, and I will be presenting tonight on the Joint Commission and the Center for Medicare and Medicaid Services. After this presentation is completed, I'm hoping that you, the audience, will have a better understanding of what the Joint Commission, or TJC, and the Center for Medicare and Medicaid Services, CMS, programs are. We'll also have a better understanding of the relationship between TJC and CMS, what it means to have a Joint Commission Medicare deemed status, and how CMS is notified of accreditation survey outcomes and statuses. To begin, I'd like to start with a brief history of both the Joint Commission and CMS, just to give everybody a better understanding of their backgrounds. So the Joint Commission was founded in 1951 to improve public health care. The goals of this program were to improve public health care through the evaluation of healthcare organizations and inspire these organizations to excel in providing the highest quality of care through safety and value. This nonprofit organization is the oldest and largest standard setting and accrediting body in healthcare. The Joint Commission currently evaluates and accredits over 21,000 healthcare organizations and programs in the United States. Now on to the Center for Medicare and Medicaid Services. This program was established in 1965 and was created to combine the Medicare program, federal portion of the Medicaid program, the State Children's Health Insurance Program, also known as CHIP Plus, and quality assurance activities under one administration. CMS consists of 4 parts. Part A helps pay for costs associated with hospital care. Best way to look at this is Part A is focused on inpatient care, but can also help with costs pertaining to hospice, home health care, and skilled nursing visits. Part B focuses on more of the outpatient services side of things, which include office visits, lab work, x-rays, any preventative care needed. Part C covers everything Part A and Part B don't. And what's nice about Part C is this allows for private health insurance plans to make a little extra money by offering this to members. Part D, best way to look at it is Part D is for drugs. So Medicare Part D assists with paying for prescription drugs over the counter and at the hospitals. The relationship between TJC and CMS, they have a common goal of helping healthcare organizations provide a high quality of care, safe care, treatment, and services for all patients and their families. Although the 2 accrediting programs have different requirements, processes, and approaches, these programs' requirements nearly mirror one another, and actually the Joint Commission is a little bit more stringent and requirements are a little bit higher than just regular CMS guidelines. So what is Joint Commission Medicare deemed status? Deemed status is when deemed accreditation survey occurs in lieu of a state agency survey and must meet Medicare certification requirements. Having Joint Commission Medicare deemed status means that the healthcare organization is in compliance with federal hospital requirements. Upon completion of the enrollment process, CMS determines and awards the healthcare organization with Medicare certification and CMS certification number, or CCN. It's important to remember that Joint Commission is voluntary, but CMS accreditation is required if hospitals and healthcare organizations want to receive reimbursement for federally funded programs such as Medicare and Medicaid. CMS notification of the Joint Commission results. So, for healthcare facilities receiving Joint Commission accreditation for deemed status, the following will occur. The Joint Commission will issue a Medicare recommendation letter informing CMS of the participation in a deemed status survey. This letter will have the Joint Commission's recommendation for Medicare certification, dates of survey, outcome, effective dates of accreditation, and the locations included in the scope of the accreditation. A copy of this letter will go to the CMS central office and regional office, but the final determination is made by the healthcare facility's regional office, or CMS's regional office. If the hospital failed its accreditation or failed to fix any of its discrepancies, the Joint Commission will have to inform CMS. The Joint Commission will provide all information to CMS to include pertinent documentation, contingent accreditation, and denial of accreditation. So now that we've covered these areas, I wanted to conclude by just doing a quick refresher on everything that we've just discussed. We've gone over what the Joint Commission and what CMS are, the relationships between Joint Commission and CMS, what it means to have Joint Commission Medicare deemed status, and how CMS is notified of accreditation survey outcomes and statuses. Here is my reference page. I look forward to reading your feedback and answering any questions that you may have. Have a good night and thank you.